Here we discuss the results of a study that assessed the performance of the essential public health functions in India. We discuss the study's objectives, the methods used, and the findings and the lessons learned. First, the study objectives. Despite substantial progress, India has quite poor health indicators, although it has a considerable technical and administrative infrastructure. We study how India's public health system works to learn how it could function more effectively. And here we discuss the findings from the survey of the central government. So, some quick background. What does a public health system do? While medical services focus largely on individual patients, public health services focus on reducing the whole population's exposure to disease. For example, through services such as disease surveillance and outbreak control, control of mosquito-borne diseases, and implementing public health regulations and standards, for example, to assure food safety and water quality. These services provide a classic public good, and so are the primary responsibility of any government. They are publicly funded and delivered, even in the US, where much of medical services are privatized. And these services cost little. For example, they cost only 2.6% of total US health expenditure in 2014. To preview the study findings, what the responses show is clear areas of strengths and weaknesses that cut across most of the functions. What the reports show is strong technical and administrative structures, but weaknesses in execution. So the bottom line is that they show that there's a substantial and impressive system in place, but that simple changes in execution could sharply increase the system's effectiveness. So, the study methods. We used the questionnaires that had been developed by the WHO, PAHO, and the US Centers for Disease Control. These were developed to assess the performance of the core functions of a public health system, now called the Essential Public Health Functions, or EPHFs. These questionnaires focus strictly on how the functions are performed and not on a multitude of other issues such as financing. We modified these questionnaires for use in India, and we modified the survey method in that we administered the questionnaire to individuals, not to focus groups whose responses may be affected by group dynamics. The questionnaire is divided into sections, one section for each essential public health function, and subsections with more detailed questions on the performance of that function. Each question has a yes-no response, and we scored each indicator between 0 and 1 based on the proportion of positive responses to the question. Findings. We discuss here the findings from our survey of senior staff from India's Central Health Ministry and from the National Institute for Communicable Diseases, which is now the National Center for Disease Control. To put a perspective on the findings, the main role of a central health agency in a large federal setting such as the United States and India is to set health policy objectives and to guide and support state and local health authorities in acting on national and regional objectives. This survey was done in 2003, and there have been efforts since then to improve services, which are summarized later. So, turning to the summary scores for the essential public health functions at the federal level in India 2003, we see that the strongest functions are in epidemiological surveillance, in health situation monitoring and analysis, in reducing the impact of emergencies and disasters, in the management capacity to organize services, and in the development of policies and planning. The weakest functions were public health laws and their enforcement, social participation and empowerment, ensuring the quality of health services, and human resource development and training. There are consistent patterns across the responses which show strong and weak areas. The strong areas reported for most of the functions are technical expertise, having written guidelines, protocols, and standards in place, and a vast network of research and training institutions and laboratories. The weak areas consistently reported are in the dissemination and use of data, learning and innovation, in partnerships, and in support to subnational levels. So the bottom line is that the respondents report strong technical and administrative structures, but weaknesses in execution. Another consistent pattern across the essential public health functions is respondents initially have a positive assessment of a function, but then they report key weaknesses when they look at the sub-questions. For example, when asked whether the health ministry has the competence needed to exercise leadership in the health system, most people say yes. But when asked sub-questions like, do these competencies include conflict management, leadership development, the development of teamwork, much fewer people say yes. In fact, the majority say no. So it's clear that small changes could greatly enhance effectiveness. One such change is disseminating information. When asked whether the health ministry has the capacity to collect and integrate data from internal and external sources, most people say yes. Again, they say yes when asked whether they have the systems to process the data into comprehensive databases to be used in the planning process. But many fewer, the majority, say no when asked whether the health ministry ensures that this information is made available to subnational levels. And fewer still say yes when asked whether the health ministry provides technical assistance to subnational authorities in the use of these data. Another example of how small changes could increase effectiveness is working with partners. In function number 6, development of policies and planning, this function got a high overall score, with many reported strengths, including in technical competence and procedures, but reported shortfalls in identifying and engaging potential partners to help advance the plans, and in preparing summaries for policy discussions to explain public health issues and policy options. Yet another example of small changes that could increase effectiveness is sharing data and responding to feedback. In function number 1, health situation monitoring and analysis, the overall score is amongst the highest, with again reported strengths in expertise and resources, but reported gaps in communicating findings to end users and in improving the quality of the information. Most respondents reported that even suggestions from the Health Ministry's own evaluation unit are ignored. Some key public health functions are overlooked, notably public health laws and their enforcement, which is so fundamental to disease control. The function got a low overall score, which reflects little focus on public health and sanitary regulations to reduce exposure to disease. It also got low scores even for competence to draft, review, and enforce laws. This is in sharp contrast to most of the functions where respondents reported a high technical competence. And it got very low scores in enforcement, such as whether almost nobody said that there was regular training for enforcement personnel. So what lessons did we learn? There's some key issues for systemic reform. System efficiency is reduced because some key public health functions are overlooked, such as public health and sanitary regulations. And management procedures need improving, including in disseminating information, in responding to feedback, and in collaboration with state and local governments, with communities, and other public and private agents. Another lesson learned is that it's crucial to educate health officials on what is entailed in carrying out public health functions effectively. The international dialogue mostly ignores public health functions, so officials are not easily exposed to these ideas. Respondents showed awareness of critical gaps in the system only when specifically asked about them. And it's interesting that the US CDC notes that the questionnaires help educate survey participants in the US health agencies by raising their awareness of the many activities related to improving the public's health. So this questionnaire is a very useful tool, not only for assessment, but also for outreach and educating key health staff. So what factors facilitate the use of these policy findings? Firstly, the central government has very considerable powers. The Constitution grants the central government authority for communicable disease control, and this authority is shared with the states. But the Constitution specifies that the central laws override those of the states on this issue. The center also has very strong fiscal leverage over the states, which it can use to persuade them to adopt specific health priorities. They have a great deal to offer in terms of technical expertise to help achieve these goals, and they have a very strong network of administrative and technical institutions in place to help achieve these goals. And the factors hindering the use of these policy findings are, firstly, low awareness, even at the top, of what is entailed in carrying out public health functions effectively, and a managerial culture that needs to focus much more on learning and innovation and on collaborating with subnational levels and other key actors. But our findings indicate that there are strong technical and administrative structures in place, and that simple changes in execution could sharply increase the system's effectiveness. There have been several central government health initiatives since this survey that potentially affect public health. Perhaps the most important one is the National Rural Health Mission that has been in place since 2005 and has expanded since then and is now expanding to cover urban areas. This seeks to improve grassroots health service delivery and to expand community outreach, for example, through a new cadre of community health workers and by encouraging the establishment of village health, sanitation, and nutrition committees. There has been some interest in public health laws, and several technical institutions have been revamped. For example, the National Institute of Communicable Diseases was converted to the National Center for Disease Control, and a number of research and training institutions were set up, including a range of major private sector initiatives in this field. There were also several initiatives on medical services, such as health insurance. These initiatives are very encouraging, but the central government still urgently needs a clear understanding of what a public health system is and does, so that the initiatives can work together within a coherent plan, and some reforms to enhance the system's effectiveness, such as collaborating with other key actors. A public health system is the top health sector priority for a government. It's relatively low cost and has a huge impact on people's health.